The Universal Health Coverage Day was yesterday, and the topic is quite apt. And it says, government, it's on you. And there's no better way to put it. We cannot discuss the healthcare of our country outside of the context of our present social economic realities. You can't talk about healthcare cost and affordability and accessibility without talking about the cost of petroleum products. There's a nexus. And in the last 1 year or so, we are seeing many more people, millions, being pulled into poverty. And don't forget that these people would have to pay for their health care by themselves because there's no social protection and no insurance for health care. The director from the Federal Ministry of Health talked about 2 million people. I listened to the minister's speech yesterday, quite reassuring, though progress is being made, but painfully slow. And, you know, when you make progress on one hand and then the progress is taken away from the other hand, you don't, at the end of the day, there's probably a zero progression or a net negative. In 2012, I was a member of the committee that hosted the African Heads of State in Nigeria at the International Conference Center. It was Abuja plus 12 meeting. And it was to reinforce the meeting that was held 10 years before that time to talk about investment in healthcare. And in that meeting, it was agreed, and every head of state in Africa signed to that document, that 15% of the healthcare budget should be plowed into healthcare. Since that time, the highest we've gotten is 6%. Even the last budget, the current budget we are using now, is still less than 5%. So because if you don't invest in healthcare, you're not going to get the results. It's simple as that. So we have a lot of other things that have become priorities to us as a country. And healthcare is on the back burner. Until we address that, we're not going anywhere. Secondly, the National Health Act, which was signed into law by President Goodluck Jonathan in 2014, that document speaks to a lot of the problems that would have addressed universal health care coverage. But I can tell you that as we speak, not up to 30% of that law, piece of legislation has been operationalized. I don't blame this current government. It's been coming from a long time. Not up to 30%. That document is waiting to be dusted and brought into the fore. He talked about a basic health support fund. That is only relevant with respect to the government sector. But studies have shown that 70% of Nigerian patients access private hospitals for their healthcare need. There's no medical director of any private hospital that have heard anything about the basic healthcare support fund. Meanwhile, if someone is involved in an accident today, they will bring the person to, if he's around this place, they will bring the person to my hospital because he's close and is known. Question, who will pay for that person's immediate emergency care? I thought the government should have contacted people like us and every private hospital to say, you know what, we've got your back. There's money for you. If you treat, we will pay. But that's not existing. Even government hospitals cannot even boast of that. So there's a lot that needs to be done. As we speak, only less than 10% of Nigerians are insured. With all the figures that we've been talking about, far less than 10% of about 240 million people. That means we are talking about less than 20 million people.
Even those that are insured, what do they enjoy?
Question, I was coming to that. Those that are insured, what is covered? The insurance system is so, because just make sure that it's just malaria and gastroenteritis and headache. Because if it goes beyond that into real medical, crisis, you're on your own. So we can't really be talking about universal health care coverage. Let's sit down and have a robust discussion with the governors, the commissioners of health, the minister of health, coming together and say, look, where do we put our finger on this? And it starts from investment. And that investment, we must look at the budget. I think I will stop here for now.
All right, many thanks, Dr. Otabor. I'd like to